Hi, my name is Karen Martineau and I'm a nurse and a lactation consultant, and I'm here with another nurse today, Tanya, and she's going to pretend to be the patient, and I'm just going to run through an example of how we go about teaching how to use pumps in a hospital setting. So, Tanya, I brought everything in that we need for showing you how to use this pump, and your pump is a Medela pump. Now, these kits that we get from the hospital, they allow us to use these supplies with more than one kind of pump. You've got the Symphony right here, and that's what you'll use while you're in the hospital, but it's really possible that when you go home you'll use a different kind of Medela pump, so don't throw any of the parts away. You won't use them all while you're here, but keep them all, okay? So let me just open that. And that sink, this little pink thing, we call that our little sink. So that's for washing your pump parts while you're here in the hospital. And you'll see inside there's a little brush and a little packet of soap. You don't want to wash your pump parts with strong hospital grade soap that has all those chemicals in it, because that's not safe for your baby's mouth. So this is just a little packet of Castile soap. And when you go home, any kind of soap that you would sort of wash your kitchen dishes with at the kitchen sink are fine, like Dove, Palmolive, whatever you use, okay? So you can see there's a lot in this kit. So what I'm gonna do is start by just narrowing it down to what you're gonna use first of all, okay? We'll go through that, and then I'll give you a little bit of information about the other pieces that's in there. So you'll forget some of what I'm telling you. So just know that it's all in writing too, and that's going in this bag. The pumps, you can see, have this little white valve. That's the easiest thing to lose when you're cleaning it or even taking it apart. So they give you an extra set. That's going in the bag. We're not going to use this part right now, so I'm putting that aside too. And it comes with 4 bottles. 2 are these smaller size, which is appropriate for getting started here in the hospital. And these 2 are bigger for when you're starting to make more milk. So I'm just going to put these away for now. And they give you 4 lids, so we'll pop 2 of them away. Now you'll see these things, they're called flanges, okay? And they have 4 of them. There's 2 different sizes for you to choose from. They write it on there, right there, 24 millimeters. And 27 millimeters. So they're talking about this dimension here. So really this is just finding what fits you. You can take a look and just eyeball it and see what you're gonna wanna have. Is you're gonna wanna have your nipple centered, kind of filling the space without creating a whole lot of friction on the side. So if you feel like your nipple is small and you're kind of lost in the middle of this big one, swap it out for the smaller one. Get a fit so you can have some pressure on the areola around your nipple, but that you're not getting this friction happening throughout here. So it's possible that you'll use both sizes. Sometimes moms get engorged and they go up a size just for those couple of days. So both sizes. Okay. All right, we're starting to narrow it down to what you're actually going to use all the time while you're here, okay? So what that looks like in your kit is that. Everything else, I'm just gonna set aside for a minute so we don't confuse you. All right, so what I like to do for teaching people how to take these apart and put them together is have you do one and I'll do one. So hold this and this. So you've got a complete set, and that's how it's gonna look pretty much when you've got it put together. But for starters, let's take the whole thing apart. So take your flange off, take this off, take that off, and even the little white valve comes off. So that's how it's gonna end up in your sink when it's time for washing. You're gonna throw it all in there. So after you've pumped, you've thrown it all in there, every piece taken apart. So every piece is separate so it can get nice and clean. Warm water, little drop of your Castile soap, not too much, a little goes a long way. You'll have some bubbles in there. Give it a good scrub, good rinse, and then you can lay it to air dry on that towel there, okay? So now, let's pretend it's the next time to pump and you've got to put this back together. So I always start with the yellow and white first, okay? So grab one of each. So I start with my smallest pieces first, and you can see there's a little half moon shape on the yellow and a little half moon shape on your white, just pop them together. So you're just gonna press that foot, that little valve onto there. And when you've got it in, it'll be nice and flat. You did it. Yeah, so nice and flat like that. Then you take this funky little neck piece, okay? The good thing about this is you can't do it wrong. So if you try there, it's not gonna work, it's not gonna work. Once you get it to the right spot, you just flip it over and give it a little press, okay? You can see that this is, has, what do we call that? We can twist it on. So we're gonna just twist that bottle right on top of there, okay? Then the flange is the last thing that goes on, and that's just a press onto that section. Okay. So now the part that you're gonna hold on to is all put together. Now you have to connect this to your pump machine. So your tubing here, the nice thing about this tubing is you don't have to wash it each time because only air goes in here. No milk goes in this part. Okay, so this part, once we attach it to the pump, it can really stay attached to the pump while you're here. You just want to remember to bring it home when you leave. They come with a little space there. This is a vacuum. If we have any leaks in the system, it's not going to suck. So we want to push that together, put it on there. And I want you to do this one just so you'll feel what that feels like. You're centering it over that top and then just pressing on the dome until you feel it snug. And then this just closes. And then really what I usually tell people to do in between pumping sessions, just kind of, you know, do that with your tubing. Then it's up off the floor, but it doesn't have to be washed each time. Okay, so now you take one of those and one of this part, and you'll see there's a small circle at the bottom. That's where this is going to get plugged into. Yep. There. Okay. So you've now set up your pump and you're ready to use it. You have to plug it in, okay? And then you're going to turn on the power button. And while you're just making drops of milk, you're going to press the drops button. Then this becomes how you control the strength of the suction. We want you to use it as strong as you can with zero pain. So I usually start it on the low. You can see the drops will increase as you turn it up. Start it on the low, place it on your breast, turn it up, kind of feel, keep going, kind of feel. And then if it feels a little uncomfortable, just dial it back until you've got your full comfort again. We don't want anything to hurt. And these are designed to be see-through so that you can take a look and assess how it's looking. You might take a moment to have to reposition a couple times. We want your nipple centered in the center of this opening. And you will see it move into here, but you don't want to have a lot of friction, okay? If you're seeing a lot of friction, swap sizes. So I'm not going to go over the pump frequency and duration because that is so varied based on what patient you're helping. But every patient using the hospital grade pump is going to need teaching and how to set it up so that you know for sure that your patient's understood. I'm going to ask you these questions if you're the patient. So do you feel like you know how to put the pump together?
Yes.
Okay. Do you feel like you know how to clean the pump?
Yes, I do.
Okay, great. Then other questions that I might ask based on appropriateness are, do you have a pump for using at home? And if not, strategize how they're going to get one. I think every patient should know how to hand express, and we could be teaching the method of hands-on pumping, but that would be for another video. And then, of course, any questions that you have, let your patient ask you those questions. I hope that helps with how to approach patients and teaching how to use the pump.